Ovarian Cancer Canada welcomes you to this session of our telephone education series for women with ovarian cancer and for their caregivers. Today's program is entitled Complementary and Alternative Therapies in Cancer. I know that today's speakers will provide you with helpful information about an area around which there are many questions and some concerns. In the feedback that we've received from our previous audiences, there was great interest in this particular topic, so I'm especially pleased we can provide this session for you. I'm Fran Turner, National Program Director of Ovarian Cancer Canada. Ovarian Cancer Canada endeavors to provide women with ovarian cancer and their caregivers the information that they need. We hope that you'll find this session interesting and that you will address any questions to our speakers. I want to let you know before we start into this session about our upcoming session on March the 13th. It's about 2 significant side effects of treatment. Christine LeBlanc, who is a registered nurse, will address the short and long-term effects of fatigue related to treatment, and Dr. Dion Provencher will present about chemobrain, a concern that, thanks to research, is finally regarded as a legitimate treatment side effect, and that cancer survivors have had a lot of issues with. Now about today's session. Many women have questions about the safe use of alternative and complementary therapies, or CAM, in helping to deal with side effects of treatment for ovarian cancer. Women are also looking for ways to attend to their well-being in general as they go through treatment and beyond. At the same time, it can be difficult to engage members of their healthcare team at their cancer center in a discussion about CAM. In this session, a nurse researcher and a naturopath will discuss the use of CAM during the cancer journey. And our speakers are Tracy Truant, who's a registered nurse and a master's in nursing, who works for the British Columbia Cancer Agency. She's an adjunct professor of nursing at the University of British Columbia. She has participated in research about the use of CAM by cancer patients, and she will discuss the safe integration of CAM with a conventional treatment plan. Cheryl Proctor is a doctor of naturopathy and an associate professor at the Canadian College of Naturopathic Medicine. She specializes in women's health and has given presentations on naturopathic approaches to menopause, obstetrics, and treating osteoporosis. Cheryl has received advanced training in women's health at the Institute of Women's Health and Integrative Medicine in Portland, Oregon, and she also maintains a private practice in downtown Toronto. So I'm very pleased to have our speakers, and Tracy Truant will start.
Well, thank you, Fran, and Ovarian Cancer Canada for this wonderful opportunity to talk with you today about 2 topics near and dear to my heart, ovarian cancer and CAM, or complementary medicine. My mother was diagnosed with ovarian cancer almost 20 years ago and used a wide variety of CAM therapies. They helped her to manage the side effects of her chemotherapy. They played a big role in helping her to feel she had some control over her situation, and mostly it gave her a sense she could promote her health and well-being while living with and through cancer. And although she's not with us here on Earth anymore, I know she's listening in with delight. So I'd like to start by setting the context a little bit for my part of this presentation. You're probably all well aware that up to 80% of people with cancer use some form of CAM, and we'll get to what I mean by CAM in just a minute. Most people make decisions about CAM without the assistance or knowledge of their conventional healthcare provider. Trying to sort through the complex maze of CAM decisions alone while dealing with a cancer diagnosis and treatment can lead to feelings of frustration, confusion, and just generally being overwhelmed with information. And trying to make these complex decisions without the knowledge of conventional healthcare providers can potentially make things worse. And I want to just briefly give you 3 examples of some patients I've worked with that haven't felt confident or comfortable talking with their oncology healthcare team about their CAM use, and it's actually prevented them from getting the outcomes they were really looking for. The first is a woman with breast cancer on chemotherapy who, before her cancer diagnosis, used Dong Quai and evening primrose oil to manage some of her PMS symptoms. And she continued to experience those symptoms while on chemotherapy and chose to continue to use those two CAM therapies. What she didn't know was that her chemotherapy and the Dong Quai and the evening primrose oil actually potentiated or made their bleeding problems worse. It made her platelets drop, and she ended up having some significant bleeding problems. It delayed her treatment. She had reduced doses for her treatment, and ultimately she wasn't able to complete her curative chemotherapy treatment regime. The second example is of a woman with ovarian cancer on chemotherapy again, who started to experience menopausal side effects while on her chemotherapy. And one of her good friends actually was experiencing the same menopausal symptoms and was using black cohosh. So the friend recommended that her friend with ovarian cancer use the black cohosh, which she did during her treatment. The patient didn't feel confident and comfortable talking to her healthcare provider about the CAM therapy, ultimately finished her treatment, and only found out much later, after her treatment was completed, that black cohosh actually decreases the effectiveness of cisplatin, one of the main drugs in her chemotherapy treatment regime. And she had a great deal of regret about having done this during her treatment and not talking to her healthcare provider or someone who could have warned her about this potential interaction. And the final example is of a person with ovarian cancer who was experiencing a great deal of anxiety about her diagnosis and her treatment. Didn't feel confident to talk to her healthcare provider about CAM, and what she didn't know is that one of her healthcare providers was actually trained in meditation techniques and could have offered her this therapy to help her with her anxiety. So not talking to healthcare providers about CAM could ultimately lead to missing out some effective CAM therapies that may be helpful. So what I hope that you will take away from this presentation is that you become better prepared to talk with your healthcare provider about CAM. On the flip side, I'm also working with healthcare providers to help them become better prepared to talk to you about CAM. I've been really fortunate to be able to collaborate with some pretty amazing researchers over the past 5 years or so. In particular, Dr. Linda Belnies from the University of British Columbia School of Nursing and Dr. Maria Verhoff from the Department of Epidemiology at the University of Calgary. We mostly have focused on understanding how people with cancer and their families make decisions about CAM while being treated for cancer. Patients in our studies have consistently told us that a gap exists between conventional and CAM worlds, and that there are things oncology healthcare providers do to both widen and narrow that gap for patients. We hope through our research we're able to make recommendations to conventional oncology healthcare providers about how to help people with cancer make safe, informed decisions about CAM, essentially narrowing that gap between conventional and CAM worlds as much as possible. For the next 10 minutes or so, I'd then like to focus on what we've learned from our research that you can take away and use to make informed decisions about CAM during your cancer experience. I'll begin by defining CAM, differentiating it from alternative therapies in integrative medicine. Then move on to talking about some emerging evidence in the scientific literature for the use of certain CAM therapies during cancer, and end with talking about some helpful hints when searching for CAM information and making CAM decisions. So what I won't be doing is giving you specific recommendations about which CAM therapies you might try. This kind of discussion is very complex and needs to be individualized, and should be done with a healthcare provider that knows you, your beliefs, values, and goals, and knows the details of your health and your cancer.